Just imagine that you are peacefully washing dishes when, all of a sudden, a family member begins to stutter, look disoriented, and appear weak on one side of the face. Still, could they be having a stroke? People must know the first indications of a stroke since they may determine a living or dead condition. Strokes rank among the most frequent types of premature death and disability in people all over the world. However, not everyone knows the signs, which they can confuse with other benign ailments, usually neglecting them. Can you identify a stroke if you or your loved one happens to be a victim? Below are 9 signs that you should never disregard. 1. Sudden numbness or weakness. Among the most apparent symptoms of a stroke is a sudden onset of numbness or weakness found on one side of the body. This symptom is usually localized to the face, arm, or leg. Do you ever feel sudden weakness or tingling in your body? This sensation may make you think that your limb has gone to sleep. However, such is far from good. The American Stroke Association defines this sudden weakness as one-sided face or limb drooping. It can also be described as a weakness that comes and goes on one side of the body. The cause for this is the reduction of the blood supply to the brain, which, if done with some speed, will indeed harm the cells of the brain that control muscles and sensations. 2. Confusion and trouble speaking. Think of how a typical conversation feels when you only utter gibberish every time you open your mouth to speak. This is very dangerous and overwhelming for the person it is happening to and their close friends and family. Have you ever been embarrassed for several moments when you are trying to say something that comes out wrong, or when listening and comprehending becomes difficult? Slowness of speech, difficulty comprehending speech, or confusion are among the most important signs of a stroke. This is especially true if the affected part is in the brain, which handles the ability to communicate in words. Research indicates that aphasias, which are due to damage to these regions, are among the more frequent stroke complications. 3. Vision problems. Have you ever considered getting up one day and having blurry vision the next? Vision problems are also considered a stroke symptom. The patient may see things blurred or have blind spots. Such ailments can be an eventual failure in vision, eye diplopia, or even temporary blindness in one or both eyes. Have you ever had such feelings, or did you ever feel that you saw something wrongly or had a dreadful vision? These are usual since, depending on the location and size of the stroke, it may damage the areas used for processing images. One must act fast because even if the treatment is done, the victim may lose sight permanently. 4. Severe headache. Everybody gets a headache occasionally, but have you ever woken up with a headache that felt like one of the worst pains you have ever endured? An intracerebral hemorrhage is a burst blood vessel in the brain, and the common symptoms include sudden, very severe, worst headache ever. It is a stroke in which there is bleeding in the brain or around it, which puts pressure and, in the process, causes a lot of pain. Hemorrhagic strokes take 13% of all instances, but seem to claim a proportionally greater percentage of losses due to their nature. It is often associated with sudden bleeding in the brain, which results in increased pressure in the skull and severe pain, accompanied by other neurological manifestations. These headaches commonly present with symptoms like nausea, vomiting, change in mental status, and dislike for bright or any light. These headaches differ from joint tension or migraines because of their intensity and abrupt nature. According to a study, several patients with subarachnoid hemorrhages, a kind of hemorrhagic stroke, indicate that they are suffering from the worst headaches of their lives. Such headaches are called thunderclaps because of the explosive onset. So if you feel such a headache or someone you know feels such pain, the right thing to do is to consult a doctor immediately. 5. Dizziness and loss of balance. Experiencing dizziness or difficulty in movement is not always a result of exhaustion or losing hydration. Have you ever felt that you sometimes have grounds for falling freely without having any legitimate reason for it at all? Some signs may be that the patient experiences sudden dizziness, lack of balance, or coordination, and these should alert a doctor, especially if the patient has other symptoms. These problems happen because some of the brain cells that are impaired during a stroke contain the cerebellum, a kind of motor skills control of the brain. If blood circulation to the cerebellum is reduced in any way, there may be sudden, severe dizziness, and the sufferer may not be able to walk or even stand up. This is one symptom that is dangerous, mainly because affected patients have high risks of falling and suffering other related complications. Research in the Journal of Stroke and Cerebrovascular Diseases also showed that patients who reported dizziness and imbalance during their stroke period and after the hospital stay had a higher tendency to fall and experience further injuries. 6. Difficulty swallowing. Has there been a time when you felt a constriction in the throat area and could not breathe properly? Speaking problems in the form of trouble swallowing, commonly referred to as dysphagia, is another sign of a stroke. This symptom occurs when the muscles that assist in swallowing are paralyzed due to brain disorders. It is disturbing and often poses risks to various aspects of human life. Problems in swallowing can cause choking or aspiration pneumonia, in which food or liquids go down the windpipe rather than the food pipe. 7. Facial drooping. Have you ever realized that one side of your face could not move like the other? A specific sign of stroke is when one's face droops, as seen in the case of the man with a slumped mouth and one lid drooping, and the cheek of the affected side is also dropped. You may observe it when a person smiles or attempts to make facial expressions, and one side of their face does not work correctly. This unequal behavior of the facial muscles can be shocking enough to inform someone that something is wrong. This is the case because a stroke can take its toll on the nerves responsible for the facial muscles. Namely, the weakness of the muscles on the side of the face caused by the strokes in the motor cortex or the pathways of the facial nerve result in this kind of drooping. It is usually one of the patient's first symptoms and should not be overlooked. In a study published in the magazine of the American Heart Association, it was noted that in cases of stroke, particularly the ischemic kind that affects the blood supply to specific regions of the brain, one of the initial signs is the experience of facial drooping. In the perception of other researchers, timely identification of symptoms, such as facial weakness, can significantly decrease the effects of the stroke because intervention is achieved quicker. It is essential to indicate that if one suspects their face is drooping, seeking medical attention as soon as possible is critical. When identified and acted on, this sign ensures that no more damage is caused to the brain and the prospects of the patient improving are realized. 8. Fatigue. We all feel tired sometimes, but have you ever experienced sudden, unexplained, extreme fatigue? This type of fatigue can be a warning sign of a stroke. Unlike typical tiredness that comes from physical exertion or lack of sleep, stroke-related fatigue appears abruptly and is often severe. It can feel like your body has suddenly been drained of all its energy, leaving you overwhelmingly exhausted without an apparent reason. When your brain doesn't get enough blood flow, it can cause a sudden drop in energy levels, making you feel tired and weak. This happens because a stroke disrupts the brain's ability to regulate various bodily functions, including energy distribution. The affected brain cells are deprived of oxygen and nutrients, leading to their malfunction and the sensation of profound fatigue. Fatigue might seem minor, but it becomes a significant red flag when combined with other stroke signs. A study published in the journal Stroke highlights that up to 40% of stroke patients report severe fatigue as a precursor to more noticeable symptoms, like muscle weakness or speech difficulties. Ignoring these signs can delay treatment and increase the risk of severe brain damage or death. 9. Sudden behavioral changes. Do you recall a situation when you caught a person behaving in an erratic or atypical manner? It is important to remember that behavior changes are an early sign of a stroke. This mainly occurs when a stroke happens in areas of the brain that control temper, conduct, and feelings. A behavior that one might perceive as a sheer tantrum could be an early sign that something more severe is happening. Although the manifestation indicating a stroke may range from the person's face, arm, or leg being pulled, and slack, balance, slurred speech and vision, mental and emotional changes are just as relevant. For instance, outbursts of anger, a dazed attitude, a sudden change of behavior are signs of a stroke. Certain areas of the brain that govern the response to stimuli and behavior, particularly the frontal lobes, can be significantly affected by compromised blood flow, thus these alterations. Another work in the Journal of Neurology, Neurology and Psychiatry reveals that 1/3 of people who suffered a stroke demonstrated notable mood and behavior alterations after the event. This can be supported by another study in Stroke Journal, which says that these changes are catastrophic as far as regenerative and rehabilitative profiles are concerned. Identifying and dealing with the symptoms early could significantly affect treatment and recovery. The sudden and unexplained changes in a person's behavior should be a sign that the person requires the services of a doctor. Warning signs of a stroke should be recognized because time is of the essence when dealing with this condition. This is the reason why the timely diagnosis of a stroke is pivotal, as it increases the possibilities of the individual rescue team to salvage some brain tissues. Have you or anyone you know ever been diagnosed with the following signs? Education and awareness of sure signs can become a lifesaver. If you observe any of these checks or symptoms, do not hesitate or think twice. Go for the medical checkup. Well, that's all for now. Keep this information in mind, share it with your loved ones, and remember it can be a matter of life and death. This is because, often, quick decisions must be made. Thanks for watching. If you enjoyed this video and found it helpful, hit that like button below. If you want to stay updated with more great content like this, subscribe to our channel by clicking the red button and the notification bell so you never miss any future content from us. Your support means the world to us.